Hi, everybody. Welcome to Conversations with Calvin. We the species. I'm talking a little fast because there's a lot to do. This particular interview with Dr. Sandy Milgram, my dermatologist, as a matter of fact, keeping it in the family, is something that is so poignant and meaningful for me. And I've been doing this stuff for 5.5 years, and I've never brought in a close medical practitioner that I've interacted with. I will talk about a little background. Dr. Milgram is a clinical professor at Robert Wood Johnson Medical School in dermatology. He's actually nationally known for a lot of laser procedures. I'm looking at my notes. Of course, I'm cheating here a little bit. And one of the first doctor to perform laser hair removal and tattoo removal in his office, pioneering. And I know I've seen videos when you've been on TV, CBS, and being interviewed because you're such a pioneer. You've been in my world since my son a bunch of years ago needed you when he was at that point in life as a young teenager. And then I jumped aboard, and you've been my dermatologist for a long time. And there's something we'll talk about. You did something that just boggles my mind, and the detective work you did to find out the problem I was having for years, and you solved it, which just blows me. Well, we'll get to it. So, this script that we're going to talk about, just to kind of let you all know, we're going to talk about aging. And by the way, this is about Ozempic Face. That's the billing. This interview is about Ozempic Face, but we're going to talk about aging and dermatology, regenerative medicine, beauty science, prevention, laser technology, medical diagnosis, detective medicine, et cetera, et cetera, et cetera. So, this Johnny Carson monologue has concluded. And it's so funny when I say Johnny Carson, 90% of the time people say, Who? Uh, who? I said, never mind. It's not important. Anyway, my Johnny Carson monologue is concluded. I am so thrilled, Dr. Milgram, that you are here and doing this right from your office. And you certainly made my day and week and month. This is just great. So you can take the mic if you have a few words you want to say, and then we will jump in to stuff that is so important. Take it away.
Well, it's so nice of you to invite me. Although I don't see Ed McMahon with Johnny Carson. So now they don't know Johnny Carson. How the heck would they know Ed McMahon? So,
Right.
but now there's a lot to talk about, and it's very my greatest pleasure to be interviewed about the latest things in dermatology.
Thank you. Thank you. Thank you. So, since this is build and all my little uh, pre-promo stuff, Ozempic Face, let's begin with the phrase that everybody's hearing. Exactly, I didn't know. What is Ozempic Face?
Well, Ozempic face is a colloquial term for the facial aging that happens after rapid weight loss from these new medications. The GLP-1 agonist is Ozempic, Zepbound, Mounjaro. So what we're talking about is hollow cheeks, sagging skin, deeper wrinkles, the kind of look where someone says, "You lost weight, are you okay?" Now, to really understand what's happening, we need to talk about how the face ages in the first place, because of Ozempic face really isn't anything new. It's just what it does is it accelerates a process that's already in motion. So there's five major drivers of facial aging. Number one is the sun. This is the biggest one, ultraviolet light. Okay, remember when they had the eclipse, they said, don't look at the eclipse because you can't see the ultraviolet light. So you can't see it, but it gets you. And what ultraviolet light does is it breaks down our collagen, it degrades elastin. Elastin is the elastic tissue, like the rubber band that makes our skin snap back. It actually creates pigmentation problems. It essentially just pre-ages the skin so that when any stress hits it, it has far fewer resources to recover. So number two is repetitive facial expressions. We said the sun, now repetitive facial expressions. So I tell patients these glabellar muscles that are right between your eyebrows, those are the muscles that create the 11s. That's like the Chris Bumstead of the face. He's like a champion bodybuilder, the number one in the world. So these glabellar muscles get stronger and more defined through years of training, every squint, every frown, every fight with your spouse, every dramatic reaction to your electric bill, that's called a rep, okay? Repetition, except instead of building biceps, you're building wrinkles. And over decades, dynamic wrinkles become static ones. Botox works well here precisely because what it does is it shrinks down these overachieving muscles. Number 3 is fat loss or fat redistribution. And during aging, fat behaves like a shifting shifting map. The upper part of it and your mid face loses volume and shrinks, while the lower face accumulates and you have fat descended in the lower part of your face. And rapid weight loss actually can further accelerate this volume loss in the upper part of the face. Number 4 out of the 5 is gravity. As Kris Jenner of the Kardashian fame reported, she supposedly joked after her facelift had slipped down. I heard she spent $100,000 on a facelift. They asked her about it, and she says gravity always wins. And she's not wrong. So as structural support weakens, the cheeks descend, the jowls develop, and the jawline softens. So there's really no negotiating with gravity, only delaying the conversation. And number 5 is sleep compression. And this is one that surprises people the most. The way you sleep can literally change the shape of your face over decades. If you sleep on your side or your stomach, it creates repetitive compression and shear forces on the skin, especially the face. I don't know if anybody remembers, you're talking about Johnny Carson, Joan Collins of Dynasty. Yeah. Well, she specifically warned that sleeping on your face causes it to get, she called it a scrunchy face, and it leads to sleep wrinkles. So reportedly, she avoided this by training herself to exclusively sleep on her back. Now, if you want a more supportive option, they make special pillows that are ergonomic pillows. They support your cervical spine, and they maintain a more neutral sleeping position, though they don't quite match the full Joan Collins level of commitment.
Wow. So I'm pulling from this. So Ozempic doesn't actually damage the face. It's these 5 things that you outlined that mess around with the face.
That's correct. The medication itself isn't damaging your face. The drugs don't reach into your cheeks and cause mischief, okay? What's happening is that the fat, the good kind, the structural kind, disappears faster than the skin can adapt. And if your collagen and elastin are a little tired from years of sun exposure, they can't simply just snap back.
Okay. You just said, you just said something about good fat. Why is facial fat really important?
Well, you have to think of it this way. If the facial fat is not there, it's like if you had a cushion that's been left out in the sun for years and the filling disappears, but the outer material already weakened can't fully snap back. So it looks wrinkled, and that's why the fat is so important. In addition to that, facial fat is the scaffolding beneath the skin. So it provides volume in all the right places, and it helps the face look vibrant or balanced. And when that scaffolding shrinks, it gives the skin the more sharper, deeper, or more fatigued look.
Okay. Is there similarities between like Ozempic Face and older dieting trends like the baby food diet, which I'm not familiar with?
Yeah, no, that's a very interesting question. I was seeing what we now call Ozempic Face long before Ozempic actually existed. In fact, back in the 2010s, there was a diet that was called the baby food diet. And the baby food diet worked by you would eat 10 to 14 jars of baby food every day. And then you were allowed to have one regular meal. Wow. So I remember I saw a patient who took the whole thing to the extreme and decided to skip the regular meal altogether. So within months, the change in her face was dramatic. The lesson was the same as it is now. The problem isn't a specific diet, it's the speed of the weight loss. And when facial volume disappears faster than the skin can adapt, the skin suddenly looks older. So the name may have changed, but the phenomenon hasn't.
Okay. You just described, 5 drivers of aging, and I just want to go back and kind of underline, like people wear sunscreen. Are they making mistakes when they wear sunscreen?
No, it's actually quite interesting, Calvin, that when I talk about all these 5 different causes of aging, the ultraviolet light is responsible for 80 to 90% of the visual signs of premature aging skin. And this process is known as photoaging. It causes wrinkles, hyperpigmentation, rough texture to the skin, loss of elasticity. So unlike intrinsic aging, which we all experience just through getting older, photoaging is largely preventable through consistent daily sun protection. Now, this is an amazing story. How did we discover this? Some of the most influential research about photoaging was done in France in the late 1970s and 1980s. So what researchers did is they looked at Carmelite nuns who lived in a convent in France, and they compared cloistered nuns who were inside, praying all day, so they had minimal sun exposure, to nuns who spent most of their time working outside in vineyards, squishing the grapes for wine. Despite being similar ages, the outdoor workers exhibited more wrinkles, more thickening of the skin, and other signs of photoaging. And this demonstrated that chronic ultraviolet light exposure, not this chronological age alone, is the primary driver for skin aging.
Okay. Yeah.
One more thing, they also looked at truck drivers because, they get more photo damage from the driver's side window, and their face is noticeably more aged on one side or other.
Wow. Isn't that interesting? I want to turn this around listening to you. By the way, if you see me writing, it's because I am writing. I'm taking notes.
Okay.
I know Johnny Carson never took notes, but I take notes because so I'm listening to this, and I listen. This face is 81 years old, and in your humble opinion, it's in pretty good shape. It doesn't why? Because I've been in this environment here for at least 12, 15 years, 12 hours a day. So that's helped my face.
I also think the Rutgers hat with the brim on it helps. That keeps the sun off your face.
Yep. Yeah, it does. So even when I'm out, but this maybe it's genetic, but also I'm just not out in the sun much. And then of course you see this, which you're helping, which you're taking care of, which by the way it's pretty good. It's doing it pretty good there. You've been working with me on this. I'm not embarrassed to say it, but it's. And I have that. Some people say I have that Einstein look, which I like. Let it just come out like that. Okay. One more.
Yeah, Calvin. Just to interrupt you, I talked about one of the aging causes was gravity, and Einstein famously said you can blame gravity on a lot of these things, but you can't blame gravity on falling in love. Falling in love.
Oh, I like that. I like that. I do like that. He's a hero of mine, Albert Einstein. I used to channel him in my extreme spiritual days because I found this picture about 15, 20 years ago, and his eyes have been staring at me for the last 15, 20 years. So one day, I don't know, 10, 15 years ago, I decided to channel Albert Einstein, and I talked to him just like I'm talking to you. I said, I know, Albert, you're busy, and I'm calling you by your first name. I know you're busy, and I'm kind of reaching out to you spiritually because I do that. I'm reaching out to you. I do not want to know anything about relativity. I don't care. But if you can send me some elements of energy that help make me a better writer, I'd appreciate that. And I'll swear, in a court of law, that my writing improved from that moment on. It's because I'm not a writer. I was never a writer, but now I wrote a book that got 11 national awards. So who knows? Okay, you moving on here. You did a Chris Bumstead analogy, and you briefly touched, but if you can just go over it again, how do facial muscles actually create wrinkles?
Well, it's very interesting about the looking at what happens is facial muscles create wrinkles the same way that if you would fold a t-shirt in the same place over and over and over again. So every time, like I said before, you squint, you frown, you raise your eyebrows, the muscles pull the skin into the same pattern. And when you're young, it snaps back. But as we, over the years, this repetition, declining collagen and elastin, the skin stops resetting itself fully. So these facial muscles become chronically overactive in certain patterns, and because of the repeated creasing in the same spot. So at first it's just with expression. Eventually they're there at rest.
Okay. And dynamic wrinkles eventually become permanent wrinkles. Why?
Well, because the skin's natural elasticity declines with age, while allowing temporary expression lines to become permanently etched into your skin.
Okay. I listen. We've all heard the term Botox for a million years. It's not in my world, but why is Botox so effective for certain types of aging?
Well, Botox works well because it relaxes overperforming facial muscles, and these are the ones responsible for facial expression lines. And by reducing the repetitive contractions, it allows the overlying skin to smooth out and prevents those lines from deepening over time. But it has to be used judiciously. Recently, I saw a patient who'd been treated elsewhere and was extremely unhappy because her Botox had been overdone. She felt she could no longer express herself naturally with smiling, frowning. She couldn't show surprise. Her face looked unnatural. And I really felt bad for her. Not to sound flippant, but her face reminded me of the title of the Disney movie Frozen.
Well, off topic. Off topic. I've seen a couple of great movie stars who I've loved. Harry meets Sally, and no mentioning no names, but they've gone through all kinds of facial stuff, and their face has never been the same. Why is that?
Well, the problem is that the trend now is to look more for a more natural look. These people that do that type of overdone appearance, society's getting away from that. There was a recent article in Allure magazine saying that you want it to look absolutely natural. You don't want to look like it's like you've had anything done.
Okay. Is there a particular? I like this. Is there a particular facial expression that tends to age us faster?
Yeah, well, facial expressions, as I say, can contribute to premature wrinkles with the frowning and what have you. But so smiling and laughing can also deepen lines around the eyes and the mouth as temporary expression lines become more permanent. The good news is that a life full of laughter may have a few extra lines, but they're usually the ones that people wear best.
Okay. Okay. I like that. Um, I want to go off topic just real quick. This is one of my favorite questions. I borrowed it from Barbara Walters, one of my heroes as a journalist. It's a fun question, and you don't even have to answer it. But here goes. Excluding family or friends, somebody living or dead you'd like to spend a day with.
Uh, that's now that's a very interesting question.
Is. It
I'm giving
is.
myself some time to think about it.
Take time. It's a fun
I
question.
I actually would like to sit at the piano with there were a composer, is Richard Rodgers and Hammerstein, that wrote all of the Broadway a lot of the Broadway musicals, South Pacific, Oklahoma, what have you, The Sound of Music. And Richard Rodgers' brother was an obstetrician,
Oh wow.
and yeah, in Queens, and his greatest work was delivering me. And
Wow.
so, anyway, so I would love to sit at the piano while, because I play a little music, some guitar, and I would love to sit at the piano and watch them, especially Richard Rodgers, create some of the music. I just think that would be the coolest thing, you know. Um, Anyway,
Wow.
that would be the person.
I love that. Wow. I never, how would I know? But wow, brother delivered you. I marvel at them and their creations. And you know what I watch from time to time? South Pacific, because it was so, people, I don't know if people appreciate just how revolutionary that was
Well,
racially.
exactly, because they tried to show the racism of when I forgot the names of the characters, but when they proposed marriage, and then Mitzi Gaynor ran away
Correct.
first, and then came because of the two children, the South Pacific children, and then she came back to love them. And of course, with the way that we're growing your hair, you're gonna have to. You can always start singing the song. I got to wash that man right out of my hair. Maybe
Uh,
you
uh, uh, great answer. I'm going to remember that. Wow. Um, um, how does back to work? How does facial fat shift during normal like aging? How does it move? Um,
Well, our fat is compartmentalized in our face, and while the ones in the upper part of the face are more full, over time it reverses, and so you have the fat actually descends as a gradual shifting, almost like a map, and you get more facial fullness to the lower part of the face. And this is irrespective; it's a chronological thing that happens irrespective of gravity or anything else.
okay. All right. Now we're going to move on to sleep. I read uh, a dozen articles a day on aging, on
Mm-hmm.
longevity, and I think I mentioned I was invited to speak at the Aging Longevity Expo in Singapore next March. Not as a scientist, just as somebody who's going through the motions, and as a layperson absorbing. But in everything I read, they give you the top 10 things. Aging, this, that, sleep is right there in the middle, and it's had an impact on me because I've never concentrated so much on making sure that I get sleep. So how does you talked about sleep compression? Uh, so you said the wrong way to sleep can actually age the face.
It's true. Actually, it literally shapes
Wow.
shapes your face over decades. And as I mentioned before, side and stomach sleeping, it creates repetitive compression and shear forces. And the vertical lines on the cheeks, the temple, and also the décolletage. I have women that come in, and that bothers them the most is the décolletage area with the wrinkling there, vertical lines. And so we do something called biostimulation that actually stimulates the collagen underneath, and it helps with removing the appearance of those vertical lines from sleeping on your side.
So you can actually, you have a patient comes in to see you, you can actually tell what side they sleep on, like immediately.
Yeah, it's not as reliable as some people may think, but you know there are some asymmetries that you can see. I think that genetics, the sun exposure, facial expressions, they play a bigger role. But so it's more of an educated. It's less of a crystal ball and more of an educated guess.
Okay. All right, moving on. Yeah, I'm tittering because this stuff is so important, and I love this, and the fact that you're giving me this time, you know, on your lunch hour and stuff, and it's just great. You were certainly among the pioneers of laser dermatology. What attracted you to this direction originally?
Well, it's what fascinated me at the start was the physics of it all. Talk about Einstein. In fact, Albert Einstein theorized that we could make lasers before anybody even created one, and it was not till about 1960 when a physicist at Hughes Aircraft, his name was Ted Mayman, was playing around on his lunch. You just mentioned lunch hour, which triggered the memory, and he actually took to a ruby laser, a ruby rod, and a flash lamp and two mirrors. And what he did, he created the first laser. And I met him once, and he told me the biggest mistake at the time was that he called in his supervisor. So Hughes Aircraft got the patent. All
Oh,
right. And then when the word leaked out, the CIA showed up, and it was on the front page of the New York Times. That doctor in California invents a death ray. Of course, it really wasn't a death ray. It could hardly burn a hole in a piece of paper. But that's the physics behind it. Actually started with Albert Einstein.
wow.
So
Wow.
the specific wavelength of a laser can selectively target structures in the skin while leaving the skin around untouched. So I was the first doctor, one of the first to use the laser. The first medical laser was a pulse dye laser to treat purple spots. Do you remember Gorbachev? He had one on his forehead. The
Oh
big
yeah,
purple.
yeah.
Right. So that was a called a pulse dye laser. We started in the early 90s. And then from there, I was the first one in the world to have one in my office. One of my patients actually invented the Q-switch ruby laser for removing tattoos. So I was the first one to have an in-office one. And from then came another ruby laser for hair removal. So it's an extraordinary experience to watch physics transform medicine.
Off-topic question. We talked about this before we went on air. Just in general about AI. Is AI going to help even develop better lasers?
Yeah, I think over time, the more what AI does is it accumulates information so quickly that if somebody has an idea, for example, I recently, about 2 years ago, I applied for a patent because what happened was a patient came in to see me, and she had vitiligo, which are the white spots, the Michael Jackson disease. And she says to me, I don't understand, my vitiligo is getting better since I started Ozempic. So then that's very interesting. I thought it was just a fluke. And then I saw another patient a month later. So then I went online and I used AI to compare the mechanism of the development of vitiligo and what Ozempic does, and it matched up. So we started doing a study using Ozempic topically for vitiligo, and it works. It
Wow.
actually works. So
Wow.
we're talking to industry about doing that, and that'll be the next podcast. But
Wow.
anyway, so that was all done through AI because it would have taken me. I mean, I would 6 months in the library to look at the different mechanisms, but it just gave it to me right away, and there was the answer.
Wow. Uh, I'm stupefied because I'm a big fan of AI. You know, I'm friendly with this guy in Poland. He did a video about me because here I am, an 80-year-old guy who spends half his day on AI. I'm even getting AI to talk to my wife. It takes a lot of pressure off, you know. Talk to my wife, leave me alone. Kind of, that's a joke, you know. In my notes, there's something about a 1927 fractional thallium laser. Why is that exciting for
Yeah,
you?
that's one of the newer lasers. It's what they call non-ablative, which means that it doesn't remove the outer layer of the skin. It creates these tiny little microthermal channels, and you can't see them in the upper layer of the skin, the epidermis, and right in below it, which is called the dermis. And it stimulates the skin's natural wound healing and collagen remodeling. So think of it as sending a firm but polite message to your skin: time to rebuild. So not only that, but because of these tiny microchannels, we're able to put these topical compounds on the skin to penetrate more deeply. Our skin has a tremendous barrier to protect us, but we are able to open up these microchannels, put on chemicals, and it helps rejuvenate the targeted skin.
Okay. Moving on. Next thing I want to talk about, uh, and this is a whole new world for me. I don't even fathom this, but there's something called salmon DNA therapy. What is that?
Okay, so people might have seen this salmon DNA therapy. It's been trending online. The science behind it, uh, behind the name is real, even though the branding sounds like something that a wellness influencer online would, who wants to sell you moon water, would have come up with. But it definitely works. So what it does is it's called PDRN, polydioxynucleotide, and it's actually purified from salmon reproductive fluids, salmon sperm cells,
Oh,
and that's where it comes from. I don't ask the nurse how she gets it, but what's generating interest is that it's part of a broader shift in medicine towards regenerative medicine. Rather than simply masking the signs of aging with your Botox, it appears to support the skin's natural repair process. It actually encourages collagen production, it reduces inflammation, improves circulation in the skin, and strengthens the skin barrier. So it's one of the most talked about regenerative treatments in aesthetic medicine. Now, it was actually invented about 50 years ago in Italy, and then the South Koreans picked it up, and now it's one of the hottest
wow.
topics.
Wow. Fascinating. You know, you said regenerative uh, medicine. I do PRP and stem cells in my knee, my old, tired, worn knee, and it makes a dramatic difference. So they're really, when I hear regenerative medicine, I'm in my small little microcosmic world. I'm a product of that because it does wonders for my knee. You know,
Right.
along with hyaluronic acid, I get that injected into my knee. You know, my poor knee has seen the world. Uh, um, I never told you about this, but you know, I was a little bit of a pioneer to help get my knee healed. So I had some Colombian doctor inject DMSO into my knee to help it because they do that with horses in Europe, dimethyl sulfoxide.
Right.
Anyway, uh, and I always like to share some of this stuff with you when I see you. Um, okay. Uh, Kind of winding down, you describe dermatology as a detective medicine. What do you mean by that?
Well, it's interesting when most cases, for example, you mentioned your situation before. Most cases of hand dermatitis look alike on the surface, but the real intellectual challenge is trying to identify whether you're dealing with irritation from wet work and detergents, which is the most common cause for hand dermatitis, or something more specific, a true allergic reaction to some hidden trigger. So as long as it's not a HIPAA violation, I'll tell you a story about Calvin, who presented with persistent hand dermatitis that had been partially treated for a while, but never fully resolved. A lot of cortisone ointments, but after a careful history and evaluation, the culprit turned out to be Thiram, a rubber accelerator used in vulcanization process. What it does is it turns rubber that's soft and raw into a more stronger, like a stronger material. And it turned out that he was using this a computer mouse that had that rubber on it. There it is, right there, right. So we got rid of the mouse. Well, not rid of the mouse, but one without this. The Thiram on it, and boom, the hand dermatitis went away. So go figure.
Yep. That was absolutely brilliant. I talk about you and I talk about that all the time because I suffered for a long time, and who knew? And who knew?
I knew.
You did. And it was like night and day, and you did the investigate. It was brilliant, truly. And this is years ago.
You see, that's the problem nowadays. My mother's 96 years old.
Wow.
And she goes to see her cardiologist. This was about 3 or 4 weeks ago. And you know the way it works now. You go to the doctor and the guy's looking at the screen and he doesn't look at you. And 50% of communication is nonverbal. So he's looking at the screen. My little 100-pound, 96-year-old mother's totally with it. He says to my mother, "Do you still live with your parents?" Because there was a question that came up with the insurance company. So my mother tapped the cardiologist on the shoulder and said to him, "Who are you treating here, me or the insurance company?"
Oh, funny stuff. Wow. Wow. Well, that's great. I didn't realize your mom, that's just wonderful. Wow. You know what? We're gonna just kind of stop now because your time is precious, and we could talk, and that's why I would love you to come back, and we'll talk about some other things, just to tap into you. It's a great experience for me. Knowing you has been a great experience, and the things you've done, for me and my family, just beyond. So you certainly have made my day and week and month, and thank you so much, Dr. Milgram, for your precious time.
And you know what, Calvin, the feeling's mutual.
Well, thank you.
That's really remarkable. The way that you've recreated yourself, and not only recreated, but the wonderful work that you do. It's just amazing. It's just totally.
Thank you. And who knew? I mean, there was no game plan. I just retired. What am I going to do? If I don't do something, I'm going to be at ShopRite every day, and I just didn't want to do that. So thank you. I'm going to stop recording. We'll do a 30-second wrap. Thank you so much.
Thank you, Cal.
You're brilliant. And I always say that you're just a brilliant dermatologist. Brilliant man. Thank you.